We have, okay, we're now recording, just so you know. We have over 50 people with us on the call today, so thank y'all so much for tuning in. We just wanted to take this opportunity to actually give the hospital an opportunity to address some of the information that has gotten out in the community in the last week or so, and just some clarification with our business leadership on exactly where we are and how the hospital plays a role in our local economic development as well, and how we can be a part of that, and how then we can share that with our circles of influence within the community. So as we get started, this is really going to be more of an informative platform today. And Van Loskoski, who is our interim CEO at the hospital, is with us today along with his team. They're going to be sharing some information in an informative manner. There'll be other opportunities for us to ask questions and so forth. I know our city and county governments are very much involved as well. And so we're grateful for that. We are blessed to live in a community where we come together when we need to come together. And so thank y'all for joining us. We want to turn this over to Van Loskoski from Stevens County Hospital. Sorry, I'm Julie Payson, for those who may not know me, with the Chamber of Commerce. Brittany Ivy is here with us as well from the Stevens County Development Authority. And we wanted to give y'all an opportunity to hear straight from the hospital team of what we are looking at and what our scenario is here. So Van, thank you for joining us, and you can take it from here.
Well, it's a pleasure to have the opportunity to speak with everyone. It's a pleasure to serve this community. And for those of you who may be on the call who I haven't met, I look forward to being able to meet you hopefully in the future. I've been in Stevens County now for right at 2.5 years. I joined in April of 19. And just a bit of background about me, I came on as the Vice President of Physician Practices. I stepped into the role of Chief Operating Officer and was last week voted in as Chief Executive Officer. And I know that's one of the things that that has been of particular interest is the change in leadership. I think I speak for everyone at the hospital in saying that we have the utmost gratitude for any former leaders of the hospital. It is a tall order to run a rural hospital, and it is a lot of the challenges that we face are the same challenges that pretty much every rural hospital faces, and I'll go over a few of those as we talk more. But I wanted to begin by saying thanks to everyone for being on the call, and by asking you all to remember our staff during this time. They are the ones who are still showing up to work when there's uncertainty buzzing throughout the air, when things are extraordinarily busy. We are and have been at capacity for the last 4 weeks now. Our COVID cases surged at a much quicker rate than our previous surges that we'd seen. Our COVID unit has been full for 3 consecutive weeks without any interruption. And at any given time, you can expect that we are holding anywhere from 3 to 10 COVID positive patients in the emergency department waiting on a hospital bed, just because we're in that kind of a situation right now. So that's a bit of insight as to what's going on in the hospital, and our staff is working tremendously hard to fill that need. That this type of volume is not typical for us, and that is one of the challenges that we as a rural hospital face. That leads to a lot of other issues, but that is really one of the leading factors into why rural hospitals struggle. It's that rural communities aren't that large, and you need a certain amount of population to be able to support certain services in a community. And we want to be able to offer as many services as we can. And we've been blessed to be able to do that, and we're finding ways to continue to do that. But it's also something where if the volume doesn't support a service, we have to be cognizant of that and have difficult conversations and say that this is the direction that the community is moving toward. And so the other challenge for us is with regard to the type of payment that we receive. And so a lot of our volume that comes to us is paid for by services by insurance companies like Medicare and Medicaid. And a lot of the patients that we see don't have insurance, and that presents for us a lot of particular challenges as well. And these are the same challenges that most rural markets face. Your government payers, which are Medicare and Medicaid, try to pay you what it costs you to render a service, but they oftentimes fail to do that. And as such, we end up losing money when we're offering services to patients who are covered by those insurances. Urban markets don't necessarily have that issue because you might have perhaps a younger workforce who has commercial insurance or something like that in greater volume than we have here. And our average age of a household here in Stevens County is slightly higher than the state average. So the number of young people that we have here in the community is of interest, and because those are the younger working class, and those are typically jobs that provide commercial insurance. And we have a lot of great companies in our community that are doing a lot to support their workforce. We are supporting ours, which is about 450 employees, as best we possibly can. And that's one of the things that is really important to our community, is that we understand the importance of the impact that every piece of the local economy has on the overall economy. From our standpoint in healthcare, there are a few things that are really vital to a local economy. And primarily it's housing. You need somewhere for people to live, you need somewhere for people to be educated, and you need somewhere to receive healthcare services. All the other pieces sort of build around that. But that's your basic infrastructure, is housing, healthcare, and education. And especially if you're looking toward making sure that you're attractive to bringing in young families and making sure that families want to move back here after, if after our kids move away and go to, a bigger city, we want them to come back here. And that's really important for us to make sure that we have those services here so that they're comfortable doing that. This does not just apply to the hospital, but it's so vitally important that the local population supports local business. And there are a lot of different ways that we can do that. But it definitely extends from our standpoint to the hospital. And it's really important because we are in a slightly different situation than a lot of other rural hospitals, in that we're in pretty close competition with a lot of other hospitals. We've got 3 hospitals that are within effectively 25 minutes of us, and then 2 major healthcare systems that are within an hour. And so it's really easy to bypass our hospital and go somewhere else. We're constantly fighting the bigger is better battle, and that's not always the case. Our staff here provides an excellent service. They're committed to our community. Many of them have been here for 10, 20, 30, 40 plus years. And it's not something that you have in a larger health system. We're very blessed to have the staff that we have here. And that's one of my key initiatives in stepping into this role, is making sure that we are showing the appreciation that we're able to, however we can, to the staff that has committed themselves to being here. And the same goes through every industry in the community. It's been so heartwarming since I've come to Toccoa to find how many dedicated people there are to this area. And some of them are transplants like Julie, who aren't even necessarily from Toccoa, but I think you would be hard pressed to find someone who is more dedicated and committed than Julie Payson. And that it's been great for me to have all of the resources that exist here that really reinforce the fact that we want our community to thrive. We want our community to do well. We want our industry to continue to sustain itself. We want our families to continue to set up here, and healthcare is an integral piece of that. And it's something just to be cognizant of when you're choosing where you're receiving your healthcare services. Because I can assure you, you might hear some rumblings about a patient here and there who had a bad experience at our hospital. That's no different than any other hospital. It's just, it spreads a little bit quicker in a smaller population, but there are plenty of people who have had amazing experiences, life-changing experiences. I invite you to go to our Facebook page and look at the video from a patient, Miss Betty Majors, who was hospitalized here for a month with COVID, and really had a profound impact on the staff, and staff had a profound impact on her. And that's the beauty of working in rural healthcare, and why I'm so called to work in a rural hospital is because it's a place where you can make an impact. And this is something where the community and the survivability of the community is inextricably linked to the survivability of the healthcare system that exists here. And it's not just healthcare, but healthcare is definitely an integral piece of that. We're very fortunate to have Brittany Ivy at our development authority, a great advocate for supporting local and making sure that people understand how we have to support each other as a local economy. So a lot of what you've heard is that the hospital is losing money. Well, it is, and it has been for quite some time, and that's for the reasons that I cited earlier. It's really easy to drive past us, so we want to make sure that we're capitalizing on volume and reassuring people that we're providing a good service here. Our CMS star rating is 3 stars. That's out of 5. Most hospitals are in that category. And if you look at who we're ranking against, you can look at some hospitals that are also 3-star hospitals. You can look at some that are 1-star hospitals, and that includes some very large hospitals in major cities. I invite you to go to the CMS website and look at that for yourself. You can look up CMS star ratings for hospitals, and I think you'll be pretty surprised at how our quality compares to some hospitals that you might expect to be at a higher quality than us. It's not the case in a lot of situations. So be sure you're actually looking at the benchmarking as it pertains to clinical quality, and that's something that's of particular importance to me, is making sure that we are very heavily focused on our clinical quality. The other aspect of this meeting that I really want to make sure that we're getting the word out is how you can help. And that's such a great thing that I've heard over the last 2 weeks in particular, is what can we as a community do to help the hospital? You say you're losing money. What can we do? Well, first you can, if you're not using our services, you can use our services if you need them. We in healthcare are in that weird position where we hope you don't ever need us, but we're here when you do. But we want to be the primary and premier healthcare provider in our region, and that's my focus and that's my goal. And if we don't have your trust, I'm going to do everything I can to earn it. The other aspect of it is, what's the immediate solution? Well, you say you need money. Where does that come from? Well, there's one opportunity that everyone can contribute in, and I'm going to have Pam talk about that more in a minute. Pam Jones is the director of our foundation, but there's a program in the state of Georgia called the Rural Hospital Tax Credit Program, and that program allows you to direct your state income tax directly to a hospital of your choice in a rural market. And that is a huge benefit to us, because what it does is give you a dollar for dollar tax credit on your state income tax. So you give us $1, you get $1 back on your state income tax. And that is hugely beneficial for individuals and for companies. Organizations can do this as well. And this is a way I personally contribute. We've set up a system here at our hospital where our employees can set aside their withholdings, and rather than directing them toward the state income tax, they direct them to this program to receive their credit at the end of the year. And it's a replicable program that that other companies, we hope, will consider implementing. That would be a tremendous step forward in helping set aside some opportunities for funding for healthcare. That was created specifically for that purpose, because the federal and state government both saw the need to implement a program where more of the tax dollars had the opportunity to exist within rural markets and sustain rural communities. That is really what I'm going to turn it over to Pam and let her talk more about, and how you can participate. And Pam, I'm just going to hand it off to you.
Okay. Good morning, everyone. I want to thank Van Loskoski for the hard work and dedication that he has given this hospital. And I want to thank the Chamber for all the support that they give the hospital as well. And for all of you in the community, I'm going to give you a little bit of background on the Georgia Rural Hospital Tax Credit. Some of you are familiar. In 2016, as Van alluded, the Georgia legislature, they recognized the rural health crisis in the state of Georgia. So in 2017, they implemented the Rural Health Tax Credit. And the reason that they did that was to incentivize individuals, C corporations, and trusts to make donations to rural hospitals. And in return for those donations, as Van stated, you do get a dollar for dollar, 100% Georgia state income tax credit. And that not only gives you that credit, but that also gives you a voice by allowing you to designate where your tax dollars are going. So it doesn't go to Atlanta, it'll go directly to our hospital, which is a huge benefit to this community. Through this program, the Georgia taxpayer, as I said, you can receive that 100% state tax credit to any rural hospital that is qualified. And to become eligible to receive those donations, what we had to do, we had to jump through a couple of hoops to the Department of Community Health, the Georgia Department of Community Health. We had to submit our 990 along with our 5-year viability and sustainability plan. And then we are designated as a hospital that is qualified to receive those donations. Now the state, what they'll do according to the information that we provided them, they rank us according to need in their system. And as some of you know, in 2017, the first year that was implemented, it was a 70% tax credit. That was a little difficult to sell, a 70% tax credit, but we actually did that. We have been a part of this program since it began. In 2018, that tax credit went up to a 90% tax credit. So in 2020, when they saw that there were not a lot of people jumping on that program, they actually increased it to the 100% tax credit that we have today. So for the first 2 years, we actually did the program on our own without any assistance. There's a program called Georgia Heart. We in 2020 decided, or 2019, excuse me, we decided to partner with Georgia Heart. And the reason being is because they had the means to access all the donations in the Atlanta area. Now, as you know, there are no rural hospitals in the Atlanta area. So when Georgia Heart became involved, they got all of the CPAs in Atlanta educated on the opportunities for their clients through this Georgia Heart, Georgia Rural Tax Credit Program. So what we did is we partnered with Georgia Heart. We have been in their system since 2019. That helps to increase our base of potential donors that we have through this program. So if a donor gives to this hospital, they can give two ways. They can go in and designate. There's a list of eligible hospitals listed, as you'll see it in the Georgia Heart website. Those hospitals are ranked according to need, as I stated. If you go in and you select a specific hospital that you want to donate to, you can select Stevens County Hospital, or you can go in as undesignated. And that's what most of the people in the Atlanta area do. So what Georgia Heart does is they start at the beginning of the list. They'll go through, that first undesignated donation that comes in, they'll give it to the first person on the list, and then they'll go down to the next list. That's how we get some of the donations through Atlanta. Now, we also have some donors in the Atlanta area that have ties to Stevens County. Some people who have lived here and moved away, some who have relatives who live here. And then I have a story that I have told a couple of times. We have a donor that actually called me and told me why he picked Stevens County Hospital as his choice of donations. And that was because he went to the University of Georgia with a girl that lives in Stevens County, and they were friends. in the band, the marching band. So he picked Stevens County as his hospital to donate his funds to. So, you know, there's different ways that we receive donations, but that's really neat. He's donated every year. He calls me and he says, this is why I donate to your hospital. There are 4 easy steps, and I'll be glad to help you with that. All you have to do is give me a call. I'll do the entire thing. I have donors that all they want to do is write a check. I handle everything for them. I don't mind doing that at all. Or you can go on the Georgia Heart website and you can do it yourself. There's an easy application that you submit to them, and make sure that when you do that, if you do it on your own, you select Stevens County Hospital as your choice of donations. Once you do that, you'll be pre-approved to make this donation. And let me back up and tell you this, there's $60 million available. Each eligible hospital can receive up to $4 million. So this donation is different from any donation that you give to the hospital, because this is not just a deduction, this is the state tax credit. So once you're pre-approved for that donation, it's tied to a certificate number. And so that certificate number is the way that the government tracks the money, because they start with the 60 million. And I'll just use this as an example. Say a donor wants to donate $10,000. Well, that certificate number is tied to that $10,000 donation, and the government deducts that 10,000 from the 60 million. So that's how they keep up with how much money is available. There is actually $22 million left available until the end of the year. And what they do, let me give you a little background on how you can apply for this. Once you go through and you make your application, in about 10 days, you'll receive a letter from the Department of Revenue stating that you are pre-approved, with the knowledge of knowing that there's funds available, because it's actually done on a first come, first served basis. Once the funds are depleted, then there are no more until the following year. So when you receive your letter of pre-approval, I also receive one on my end when you designate Stevens County Hospital. What you'll do, you typically have 180 days to make that donation. Since we don't have 180 days left in the year, you have until the end of the year, until December the 31st, to make that donation to us. It's based entirely upon how you file your taxes. So an individual filer, for the first 6 months of the year, there are limits on that money. You can donate up to $5,000 if you're an individual filer. If you're married filing joint, that number is $10,000. If you're a pass-through entity, you can donate up to $10,000. Now, July the 1st, provided there are funds left available of that 60 million, then these limits are lifted and you can make unlimited contributions to our foundation through Georgia Heart. So I have donors currently right now in the Atlanta area that are donating $80,000 to our hospital. And like I said, we are eligible for $4 million. This money can be used for anything that we deem necessary, with the exception of the CEO and the CFO salaries. Those are the 2 things that the money cannot be used for. But it is a great way to give back to this community, to designate exactly where your tax dollars are going. And, you know, it's a tremendous way to help our hospital. So I just want to thank you. If you have any questions regarding this, just give me a call. My number is 706-282-4254, or you can reach me at pjones@stevenscountyhospital.com. That's my email address. I'll be glad to do everything for you, answer any questions, walk you through this process. But like I said, this is a great way to give to our hospital and back to this community.
And Pam, I've posted your contact information for everyone in the chat board there. Also, there are several accountants in the area. If you use an accountant to do your taxes, that are more than capable of walking you through this process. Again, this is not, it doesn't cost you anything to participate. It's simply a redirection of where your state income tax is allocated. So just remember that that this money comes directly. It's the same money that you're paying now in state income tax. You just get a credit for it on your tax return. So the real benefit of this is that it's hard cash, and it's not some Pie in the Sky program. Pam, how much money have we received this year?
We have actually, we have in pledges and actual donations, because like I said, you have 180 days to donate.
Right.
So we have people who have actually been pre-approved. We're waiting for payment. We are a little over the $500,000 mark right now. So we still have a long ways to go, but we're trying very hard to reach that $4 million mark. And like I stated, the limits have been lifted after July the 1st. There is $22 million left. And if you have a state tax liability of more than what the limits are in the first 6 months of the year, it's open to unlimited donations. So it's a great opportunity for you. It's a great opportunity for us. And as Van stated, I am not an accountant. I'm not a tax advisor. So if you have any questions, my first response to you would be to contact your accountant and ask him how this would benefit you or what you can do to participate. And most of the CPAs in this area are familiar with this program. They're either donors or they have clients who are donors. So, and like I said, just give me a call. I'll be glad to help you. I'll be glad to do it all. I don't mind it all. That's part of why I'm here and what I do here. And I do anything I can to help the hospital.
And this is something, again, that is of no burden to the community either. We want to be cognizant of the fact that our community has other issues that it has to focus on apart from healthcare. And this is just one way that, without spending an extra dime of taxpayer money, that we are just supporting ourselves with the money that we're already spending in state income tax. That's all that I really wanted to cover today, and we are extraordinarily busy here at the hospital, so I'm going to give everyone about a half an hour back if you'd carved out this whole hour. But I want to thank Julie for setting this up and for organizing this forum, but also every other forum that she does in terms of promoting TCOA, promoting Stevens County, and that's really the mentality that we all have to be in, is that we are a community supporting itself. I appreciate very much all of the support that I personally have received, both of my position here, but also the high accolades that I hear of our staff. When you're talking about the hospital, you're not talking about the building, and you're talking about the people that work here. And that's really where the soul of the community is established, is the people that exist within it. And that's why I locally owned businesses, because that is where the culture of our society is developed. It's not that I don't like or use chain stores, and but if I have the option, I'm going to support a local restaurant. I'm going to support a locally owned store. And the same is true of healthcare. And it's the way that we continue to sustain ourselves, is by being cheerleaders and promoting ourselves, and being advocates for each other when we have the opportunity to, and when we're put to the challenge of saying, how are you going to respond? So I appreciate everyone's support. We have a great community here. We have a great hospital here, and I'm going to do everything within my power to make sure that both are continuing to succeed.
Thank you, Van, and thank you, Pam. Brittany Ivy from the Development Authority wanted to just share a word too. This whole topic is it's time for us to buckle down for sure as a community, because it affects our entire community and our economic development in a big way, as Van mentioned, with housing and education and healthcare, the three big things that I know Brittany will reinforce from a Development Authority perspective. We are very blessed to have the hospital here, and we are going to do our best to keep that asset in our community. Van, thank you for your leadership, and Pam, thank you for being available to the folks here. I want to encourage you, before I turn it over to Brittany real quick, to share this information with your circles of influence and encourage them to now that it's 100% dollar for dollar, it's not going to cost be any more money out of our pocket. And we need to recognize the value of our hospital in this community. You know, and I think sometimes it's easily said we just need to sell out to a bigger hospital, but here's what we've got to think about that. That doesn't ensure that any of the services that we currently have available will continue to be available if somebody else is in charge. And so I know that has been a big recommendation as far as word of mouth in the community, but there's a whole lot more to that because what we really need available here is quality services to our community for new industries who are moving in and want that available for their employees and such. So that's not necessarily always the best option. But Brittany, if you don't mind sharing a word real quick from your perspective on the Development Authority.
Thank you for everybody that's participating. I see a lot of our industries represented, and I appreciate your buying into the community and participating on the call. Thank you to the hospital and Julie. It's no secret, everybody that looks at our community to bring an industry to, or even when existing industries are expanding, want to know about our healthcare system. Every RFI, that's a request for information that I've filled out since I've been back, wants to know how close the hospital is to where they're looking at putting their facility. It's a big deal. And like Julie said, there's no guarantee if our rural hospital is brought out that we'll continue to offer the services that we currently offer. And those services are a big deal to our industries. The hospital offers drug testing and things, and they partner with our industry. I know several of our industries have taken advantage of the rapid COVID testing during this time. It's allowed them to keep employees at work that otherwise would not be able to continue working on their shifts. And so it's a big deal to industry, and we appreciate so much you all taking a part. And I just want to leave with this thought. It's not an unattainable goal to raise $4 million this way. There are 26,000 people in Stevens County. 400 families given the max of $10,000 gets us to $4 million, and it turns everything around. So let's not throw our hands up and say this can't be done. It can be done. And I appreciate y'all, the hospital, Pam, sharing your knowledge on the rural tax credit, and hopefully we'll have individuals take part of it in the community. And we're always here as a resource too. If the Development Authority can do anything for anybody on the call or for the hospital, we're here, and we are a partner. And let's change the mindset of the community. Let's not just use the hospital locally. Let's get our gas into COA. Those SPLOST dollars go back to our county, back to our education system. Let's invest in where we live. And we all need to do that every day when we're out and about, and encourage others to do the same thing. So thank you guys.
Absolutely. Thank you, Brittany. We preach and share shop local all the time. This takes it to a whole different level as well, but it applies. And so always wanting to shop local here first whenever there's an opportunity to do so. So thank you all so much. We have recorded this and we will share that. And we encourage y'all to do the same and just help tell the message in the community, help tell the story and the asset that this hospital is to our community and to the future growth of our community. Currently, as Van mentioned, our payer mix here in Stevens County, I mean, our kids get free lunches in our school system. So there is a certain amount of community that we have to acknowledge, but then with a goal to grow that and develop that. Healthcare is a huge piece to that puzzle. So please help us tell the story and build the support in our community. And Van, we are very grateful that you choose to work here and that your employees and your team choose to work here in Stevens County. And we're the beneficiaries of that. And so thank you all for joining us today. Very grateful. Check into this information that we've shared here in the chat room. Call Pam Jones at the hospital if you have any further questions. Certainly welcome to call the Development Authority or the Chamber of Commerce or Van at Stevens County Hospital if you have any further questions. So thank you guys so much. It's a privilege to be in Toccoa, Stevens County, and to get to live, work, and play here as well. So grateful for all of y'all. Have a blessed day, and we'll see you soon.